I want to welcome everyone to our summer webinar series. My name is Jordan Hines, and I am the New Initiatives Coordinator for the Epilepsy Association of Western and Central PA. We have a fantastic lineup of expert speakers today, and this month's webinar is titled Women's Health and Epilepsy, What You Should Know. Our featured presenters will include Dr. Laura Kirkpatrick, the Child Neurology Fellow at UPMC Children's Hospital of Pittsburgh, Dr. Ann C. Van Cott, Associate Professor of Neurology at the University of Pittsburgh and VA Pittsburgh Healthcare System, and Dr. Amy Collins, an attending physician at the UPMC Children's Hospital of Pittsburgh. They will be presenting on topics like healthcare management, menstrual cycles, pregnancy, birth control, medications, talking to your doctor, and self-advocacy. So please join me in welcoming today's speakers.
Hi, welcome to the meeting. I'm Dr. Kirkpatrick. I'm a Child Neurology Fellow at UPMC Children's Hospital of Pittsburgh.
My name is Amy Collins. I am a faculty in adolescent and young adult medicine, and I'm a women's health provider.
Hi, my name is Ann Van Cott. You won't be able to see me, unfortunately, today, but there's my picture. I'm an associate professor of neurology in the Department of Neurology at the University of Pittsburgh, and I see patients at the VA in Pittsburgh.
So again, thank you all for coming. Today we're going to talk about several women's health topics, including periods, also known as the menstrual cycle, preventing pregnancy using birth control, having children, and anything else you guys want. As Jordan mentioned, please feel free to type questions or topics you want to discuss into the chat box, and we will cycle back to those issues at the end during a Q&A session. So first, we're going to talk about periods or the menstrual cycle. So over the course of a month, your hormone levels change in a cyclical way, and this is why you have a period. The most important hormones to know about are estrogen and progesterone. So you can see here on this graph on the right that estrogen and progesterone levels fluctuate during the monthly cycle. These hormones are quite important for women who have seizures. Estrogen can make it easier for some people to have seizures. Progesterone can prevent some people from having seizures. For this reason, some women find that they have more seizures at certain points in their monthly cycle. In particular, some women find that they have more seizures around the time of ovulation, which is about 10 to 14 days after their period. And as you can see, around ovulation, there's a big spike in estrogen. And since I mentioned that estrogen can make it easier for some people to have seizures, it makes sense that some women have more seizures around that time. Similarly, some women report that they have more seizures around the time of their period. And as you can see on the chart, progesterone drops around the time of the period. And since progesterone can prevent having seizures, a drop in progesterone can lead to more seizures. If you think that your seizures have a monthly pattern, it can be helpful to track them on a calendar or a phone app. Some free apps include Seizure Tracker, My Seizure Diary, Epsy, EpiDiary, and Seizure Log. It's also a good idea to talk to your epilepsy or neurology doctor about it. There are certain things they can do, including considering extra medication on high-risk days. It's also important to know that women with epilepsy might be at increased risk for a condition called polycystic ovarian syndrome, or PCOS. Valproic acid, also known as Depakote, additionally increases the risk of PCOS. Symptoms of PCOS include problems with periods, including missed or irregular periods, long, heavy, or painful periods, as well as excess body or facial hair and acne. PCOS can also lead to difficulties with fertility or becoming pregnant. If you notice you're having any of these symptoms or problems with your periods, it's a good idea to talk to your doctors about that, and I would include both your neurologist, your primary care physician, and your women's health provider. So these subjects can sometimes be awkward or embarrassing to bring up with your doctors, but it's important to do so. And on this slide, we have some suggested language for how to talk to doctors around this issue. If you think your seizures are related to your menstrual cycle, you can simply say so. I think my seizures are related to my period. Or you can ask how you could tell if that's happening in your case. If you're having problems with your periods, you could simply say so. My periods are irregular, too heavy, or too painful. For our next topic, we'll address how women with epilepsy can use birth control to prevent pregnancy while maintaining good seizure control. And here I'm going to turn things over to my colleague, Dr. Collins.
Thank you, Dr. Kirkpatrick. So I'm excited to talk to you all about the different options for birth control that are available to you. I'm going to talk about them in different categories. You'll see on the left each of the categories of birth control, and the examples of those or names you may have heard those called on the right side in the table. So I'm going to give you some information about the birth control method, and then Dr. Kirkpatrick will help me to give you any specific information about how that birth control method is related to either epilepsy or medications that you may be taking. We'll start by talking about the methods of birth control that are actually the most effective that are available, and those are called long-acting reversible contraception. It includes things like IUDs or intrauterine devices, or implants that go under the skin, which you may have heard of, called something like Nexplanon. So let's start by talking about the IUD. An IUD, or an intrauterine device, is truly the most effective method of birth control that we have available. It's inserted into your uterus and can last for about 5 years. We do have data to suggest that it's actually effective for longer than this, but the FDA has approved these methods for pregnancy prevention for 5 years. You may have heard the names of these, which you can see up top, things like Mirena, Liletta, Kyleena, or Skyla.
So in terms of epilepsy and the IUD, a great thing about this method of birth control is that there are no interactions between the IUD and anti-seizure medications. It's also interesting that in a large survey of women with epilepsy reported continuing this method of birth control longer than any other methods, which suggests that they're, tolerating it well and liking it, and that it might be a good option.
Now, the IUDs that I just mentioned on the previous slide have the hormone progesterone in them. There's also an IUD that doesn't use any hormone at all, and that's called the copper IUD, or also called the Paragard. It's very, very effective at preventing pregnancy. Again, it goes into your uterus. This one is actually approved for use for 10 years. Now, keep in mind, for both this method and the hormonal IUDs, those are the maximum length of time that they can be used. You can always, of course, have an IUD removed sooner than that time period, should you choose to become pregnant, or should you decide that you no longer want to use that method at any point.
And again, similar to the hormonal IUDs, there's actually no known medication interactions between the copper IUD and anti-seizure medications.
The third long-acting reversible contraception I'll tell you about today is the implant that goes under the skin, which you may have heard called the Nexplanon. It's very, very effective. It gets placed right under your skin in your arm. This is done in the office using some numbing medication. And this method can stay in place for 3 years. It's very, very effective at preventing pregnancy.
So the one caveat to Nexplanon for women with epilepsy is that some anti-seizure medications might interact with it and make it less effective at preventing pregnancy. And these medications include oxcarbazepine, also known as trileptal, lamotrigine, also known as Lamictal at high doses, topiramate, also known as Topamax at high doses, carbamazepine, also known as Tegretol, clobazam, also known as Onfi, phenytoin, also known as Dilantin, phenobarbital, also known as Sulfaton, rufinamide, also known as Banzil, and felbamate, also known as Felbitol.
The next category of birth control that we'll discuss is the progesterone injection, also known as the Depo-Provera injection, or sometimes called Depo or called the shot. This is also a very effective method. The shot is given to you by a doctor or a nurse, typically in either your primary care office or your women's health provider office. This injection is given every 3 months. And in order for it to continue to be effective, it has to be given on time. So it must be given within that about 12-week period or 3-month period in order to remain effective at preventing pregnancy.
And a good thing about this method is it is not known to interact with anti-seizure medications. There's also some evidence that it might help prevent seizures in some patients. In a large survey of women, Depo-Provera was the only method of birth control where women consistently reported having a decreased frequency of seizures.
Now we'll move on to talk about a combined estrogen and progesterone method. These are typically thought of as things like the birth control pill, the vaginal ring or the NuvaRing, and the birth control patch. So I'm going to talk about the pills, the patch, and the ring, which all of them contain a combination of estrogen and progesterone. The pills are taken every day by mouth, and they're very effective at preventing pregnancy if they're taken on time every day. The important thing for this method is you do have to remember to take it at the same time every day, like I said, in order for it to be effective.
The pill, unfortunately, does have interactions with some seizure medications. Firstly, it has an interaction with lamotrigine, also known as Lamictal, where it can make lamotrigine less effective at preventing seizures. So if you're a woman with epilepsy and you're taking lamotrigine and you're thinking of starting the oral contraceptive pill, it's a good idea to let your neurologist or seizure doctor know, because they might need to check levels of your lamotrigine and adjust the dose of your medication. In addition, some anti-seizure medications make the pill less effective at preventing pregnancy, similar to what I said about Nexplanon. And it's the same medications that make Nexplanon less effective that can make the pill less effective at preventing pregnancy as well.
So the next method that we'll talk about is very similar to the pill in terms of the combination of hormones that are included, but instead of swallowing the pill every day, it's actually a patch that you wear on your skin, and the medications are absorbed through your skin. The patch only has to be changed once a week. So some people who find the idea of having to take a daily pill at the same time, sometimes that feels really, really intimidating or something that's hard to do with a busy life. Some people will prefer the patch because it can be worn on the skin and only has to be changed once a week rather than once a day.
And the patch contains very similar hormones to the combined pill, so it has the same medication interactions.
And finally, the last combined estrogen and progestin method that we'll talk about today is called the vaginal ring or the NuvaRing. It's very effective if used correctly. It is simply inserted into the vagina, kind of like a tampon, and can remain in the vagina for 3 to 4 weeks. So essentially you change this method once a month. So again, similar to the patch where you have to think about it less frequently than the pill. Some people will also prefer the vaginal ring because you only have to remember to change it once a month.
And again, because it has a similar hormonal composition to the patch or the combined pill, it has the same medication interactions.
Now we'll talk briefly about a different kind of pill that's called a progesterone pill or a progesterone only pill. So this is a pill that you may have heard of before called the mini pill. It is a pill that only has progesterone in it. There is no estrogen in this pill. This, similar to the previous combined pills that we talked about, does also need to be taken at the same time every day in order for it to be effective. And because of the way that it works, it's very, very important that it is taken at the same time. The combined pills do have a little bit of a time forgiveness. They can be taken 3 or 4 hours late and they'll still remain effective. These pills, on the other hand, are very, very unforgiving. So they do have to be taken really at the same exact time within the hour every day.
And the same medications that make the previous methods and Nexplanon less effective at preventing pregnancy also make this pill less effective at preventing pregnancy.
Finally, we'll talk about barrier methods and then emergency contraception. So let's talk about barrier methods first. So it's important to remember that barrier methods can be used to prevent pregnancy. There is the option of using either the male condom or the female condom. Keep in mind that these condoms should not be used in combination. You should use one or the other. These methods are okay at preventing pregnancy, but not particularly effective or dependable, though they are the only type of birth control that both prevent pregnancy and prevent sexually transmitted diseases. So it's a really, really good idea if you're using a form of birth control to prevent pregnancy, such as a pill or an IUD, that you're still using a barrier method, like a condom, to prevent STDs. Again, they are less effective than the other methods, but used in combination with a method like an IUD or a pill or the depot shot, you can get both pregnancy prevention and you can add on the benefit of having STD prevention with your condom. And then lastly, I'll tell you briefly about emergency contraception. Emergency contraception is something that's available if you are in a situation where after having sexual intercourse, either the condom has broken, you have concerns about not taking your method correctly, or if there's any worry about there being some compromise of your birth control method. This is something that can be taken after a sexual encounter. So on the left, one option is the copper IUD or the Paragard. It can be placed within 5 days of having unprotected sex or sex, for example, when a condom breaks. And it's very, very effective at preventing pregnancy in that scenario. There are no apparent medication interactions, as we talked about before with the copper IUD. On the right, the other option is something that you probably have heard of in the lay media, and that's called Plan B, or the emergency contraception pill. There's actually 2 different types. There's Plan B, which is something you can get over the counter at any pharmacy. There's also something called ELA. ELA is a method that is required to be prescribed. So typically you'll see Plan B used more often, though ELA is a very, very effective method. It just needs to be prescribed by a physician. It has to be taken, these pills have to be taken within 5 days of unprotected sex, though taking them, earlier you take them, the more effective they are. And Laura, do you want to speak briefly about interactions?
Sure.
Sorry, Dr. Kirkpatrick.
So the same seizure medications that can interfere with Nexplanon or the combined hormonal contraceptive pill can also interfere with Plan B and ELA. It's also worth noting that these methods have been shown to be less effective in obese women.
If you have more questions about these different methods or want to research more and compare them, We've provided some websites here that have really, really dependable information. It's really important that you talk to your doctors, and these are all of your doctors. So your seizure doctor, your primary care doctor, and whoever provides your women's health care. So an OBGYN, an adolescent medicine doctor, or your primary care doctor if they provide those services, about birth control and epilepsy. We've also included this table that looks a little overwhelming, so it's not meant to go into detail about now, but we wanted to provide this with you. You'll be getting the slides after this presentation, and this gives you a nice side-by-side comparison of all the different options for birth control. Now, a few important points about talking to your doctors about birth control and preventing pregnancy. Note that your history regarding birth control, your sexual health, and your desires regarding pregnancy are private or confidential. You don't need anyone's permission to have these conversations with your doctor. You don't need a parent's permission. You don't need a partner's permission to talk about or start a method of birth control. You can always, when you go to see your doctor, ask to speak to your doctor alone. If your doctor doesn't offer to have you speak with them alone, you can always ask to speak to your doctor alone and have a private conversation about these issues. At the same time, if you'd rather have your parents or your partner or other support person in the room when you have these conversations, that's also something that you can do. It's completely your choice. When you think about the language that you might want to use when asking your doctor about these issues, you can use something as simply saying, I really would like to prevent pregnancy. Can we talk about the best way to do that for me? Or you can just say, I really need a method of birth control. You can also talk about it in relation to your seizure medication. So can you help me pick a method of birth control that won't interact with my seizure medicine? Or just ask, is there any interaction that you know of between my birth control and my seizure medication?
So our final topic before we go into the question and answer period will be discussing having children. Most importantly, women with epilepsy can have healthy pregnancies and healthy babies. First, we'll talk about the risk of birth defects that is associated with some anti-seizure medications. First of all, it's really worth knowing that women in the general population who don't have epilepsy are also faced with this risk. 2 out of 100 babies in the general population are born with birth defects, which means that birth defects really are not uncommon in the general population. However, some seizure medications can increase this risk. It's important to know that your neurologist might recommend a folic acid supplement to reduce the risk of birth defects. And it's really important to plan to start folic acid before becoming pregnant. In general, it's a really good idea to plan your pregnancy months in advance and talk to your doctors, including your neurologist and your women's health provider, before you become pregnant. In addition to folic acid, it might be necessary to make some changes to your seizure medications before you become pregnant, both to decrease the risk of birth defects, but also to ensure that you're optimally protected against seizures during the pregnancy. Here's a list of some seizure medications currently known to increase the risk of birth defects. This list includes phenytoin, also known as Dilantin, topiramate, also known as Topamax, valproic acid, also known as Depakote, and phenobarbital. But other medications may also have this risk. So if you're thinking about pregnancy and you're taking a medication, it's important to talk to your doctor about what the risk might be. It's also really important to note that valproic acid or Depakote has the highest risk of birth defects, and it's also been known to cause cognitive and developmental problems in children who are exposed to it in the womb. Let's also talk about the risk of having seizures during pregnancy. Seizures can be risky for both the mother and the baby. Seizures can lead to falls, premature labor, and miscarriages. In addition, pregnancy can affect how your body metabolizes your seizure medication. So your doctor might need to check blood levels of your medications more often while you're pregnant to ensure that you're protected against having seizures. Because seizures are quite risky for the pregnancy, it's important to take your medications as prescribed during pregnancy to prevent the risk of seizures. The risk of having particularly a convulsive seizure, such as a grand mal or GTC seizure, might be greater than the risk of taking your medications during pregnancy. So what happens to seizure frequency during pregnancy? Some women report that they have more seizures during pregnancy, but this is actually very difficult to predict for everybody. About a third of women have the same amount of seizures, a third have more, and a third have fewer. The biggest predictor is that if you've been seizure-free for the 9 months prior to pregnancy, chances are you'll be seizure-free for the 9 months of pregnancy. The best thing you can do during pregnancy are the things you do in general to prevent seizures, such as taking your medications as prescribed, getting enough sleep, getting good medical care, and taking care of yourself. It's also worth knowing that your doctor might refer you to a special type of provider called maternal fetal medicine, which is a specialized obstetrician gynecologist who addresses caring for pregnant women with additional medical diagnoses such as epilepsy. Also, once the child is born, there's the question of breastfeeding or bottle feeding. And you might wonder, do the anti-seizure medications cause any risk for the baby? Large studies of nursing women have shown that there's minimal to no risk to the baby for breastfeeding while mom is taking anti-seizure medications. So breastfeeding is encouraged for women with epilepsy, even ones who are taking medications. There are many health benefits to the baby of breastfeeding. Generally, babies who breastfeed have stronger immune systems and are also at lower risk of metabolic problems like obesity as they get older. So if you're thinking about having children, it's really important to talk to your doctors about this, including your neurologist, your primary care physician, and your women's health provider. You might just tell them simply, I'm thinking about having kids. You might ask them, how far in advance should I let you know that I'm thinking about having kids? You might ask them, what can I do to have a healthy pregnancy? Or you might ask them specifically about your medication. Will I need to change my medication if I want to get pregnant? Ultimately, the choice is yours about whether you would like to use birth control to prevent pregnancy or choose to become pregnant. It's your decision. No matter what you decide to do, it's important to get good epilepsy care, take good care of yourself, and loop in all of your doctors, including your neurologist, your primary care physician, and your women's health provider. So now we'll move into the question and answer period.
Thank you very much. That was a fantastic presentation. We do have a few questions that we can address. So while we also received some questions during the last couple of weeks that people sent to me, so we can address those as well. And while we're talking about that, please feel free to send more questions in the chat box. First question we're going to address is, what seizure medications are safest during pregnancy?
Sure, so I'll address this one. There have been large-scale studies of the risks of birth defects with different seizure medications, and the medications that appear to be safest during pregnancy include Keppra, also known as levetiracetam, or lamotrigine, also known as Lamictal. I will mention, though, that if you're taking lamotrigine or Lamictal during pregnancy, it's important to have your drug levels checked often because the levels can change a lot due to changes with pregnancy.
Okay, thank you. Another question that we received was, how long before I get pregnant should I start taking folic acid?
So I can address this question. Most experts recommend that you are taking folic acid for at least a month prior to pregnancy or prior to becoming pregnant. So it's important to remember that the most important time in a pregnancy to be on folic acid is in the first several weeks. Honestly, mostly at that point before people even realize that they're pregnant. Most of the time you can't identify a pregnancy until about 4 or 6 weeks in pregnancy. That'll be the first time you miss a period. And those 4 to 6 weeks, it's incredibly important to be taking folic acid during that time period. So if there's any possibility that you could become pregnant, I think it's not a bad idea to be taking a folic acid supplement.
Okay. Now, another question that was sent in was how perimenopause could influence seizures.
I can answer that question. So a lot of the research that Laura and Amy talked about, and a lot of attention has been placed on women of childbearing potential, younger women. But less is known about the effect of menopause or perimenopause on women with epilepsy. Menopause is the time of life when a woman's ovaries stop working. And it usually occurs about at the age of 50, but there is some evidence that it might be earlier in women with epilepsy, especially those who experience catamenial epilepsy, which Laura mentioned is when seizures worsen near the time of menstruation. We know that hormones are produced by the ovaries, and those include estrogen and progesterone, and they can affect seizures. So it's not surprising, and we'd sort of expect that changes of these levels of hormones around the time of menopause or perimenopause would impact how frequently seizures occur. But it really hasn't been studied extensively. It appears that there's some groups where women who have gone through menopause actually have about the same frequency and severity of seizures as younger women. There have been some studies with a small number of women that have shown that a pattern of catamenial epilepsy prior to menopause makes it more likely that you'll have fewer seizures after menopause. Probably another issue that I should touch base on this topic of menopause is the use of hormone replacement therapy. Sometimes women after menopause use hormone replacement therapy to mitigate some of the side effects of menopause, like hot flashes, vaginal dryness, and problems sleeping. But it's really controversial whether that's recommended or not. And we really don't have a good understanding of how hormone replacement therapy would impact older women with epilepsy. One small study suggested that the seizure frequency in women who used hormone replacement therapy is good in the sense that the seizures aren't as severe. But it's really not clear in the long run what that means. So I think it's very important, and I'd like to stress that it's a team of physicians who need to take care of you, or a team of providers with different expertise. So the communication like that was demonstrated during this presentation between your neurologist, your healthcare provider who counsels you on birth control, and later on in terms of gynecological care as you age is very important.
Okay, great. So next question is, what in your opinion is the best birth control method for women with epilepsy who want to avoid pregnancy in the next 3 to 5 years?
Yeah, so I'd be happy to answer that one. You know, choosing a birth control method is a really personal choice. There are a lot of pieces that you consider when making a choice about what type of birth control to use. And each person has different priorities. If your priority is preventing pregnancy. And you want that to be something that you prioritize and make, on the top of your list. So choosing a method that is really just the most effective that's out there. The IUDs, the Mirena IUD, the Liletta, Kylena, Skyla, the ones that have progesterone in them, or a copper IUD would be the method that is the most effective, that we know would not potentially interact with any of the medications that can be used for epilepsy. Now, of course, like I said, people can have different priorities, and all of these decisions about birth control are a risk-benefit type decision, which is why it's really important to have a conversation about this with your doctor and make sure your doctor knows what your personal priorities are. But specifically, if you're looking for the method that is most effective at preventing pregnancy with the least likely chance of it interfering with your epilepsy medications, then I would recommend an IUD.
Okay. We have a few questions coming in the chat box here. So one is the packaging for Depo says it should only be used for 2 years. Is this accurate?
That's a great question. This is a very controversial topic, even within the medical community. The reason why the packaging for Depo says that Depo should only be used for 2 years is because there are studies that show that using Depo can decrease a person's bone mineral density. Interestingly, we don't have any studies that show that people on Depo have more fractures or breaks in their bones than people who are not on Depo. But we do know from studies using x-rays that Depo can cause your bone mineral density to decrease. Different professional organizations have a different opinion about whether or not this labeling on the box is appropriate. I would say if you would like to use Depo-Provera, it's a conversation you should have with your doctor. In most cases, for young women of childbearing age between 18 and 45, who are getting adequate physical activity, getting adequate calcium and vitamin D intake, and who don't have any conditions that make osteoporosis higher risk, then actually using Depo beyond 2 years is very safe. But again, I think it's an important conversation to have with your doctor so that they can assess your risk based on all the different parts of your health and considering your medications and your other medical conditions.
Okay. And another person wrote in the chat box, can you speak about the changes that occur with seizures before full onset menopause? I was diagnosed at 41 and I have started having menopause type symptoms.
So this is Ann Van Cott. As I mentioned before, it's highly variable from woman to woman when their menopause occurs. Women who have epilepsy are frequently diagnosed with premature menopause, and they can have menopause symptoms as early as 40, and that can be checked by your obstetrician in terms of hormone levels to confirm the diagnosis.
Okay. And we have a few more questions that were sent in. One is, could you talk about the medication Vimpat and any relation to tinnitus?
So Vimpat is a medication that is also called lacosamide. When they did studies on it as an add-on anti-seizure medication to another medication, the most common adverse reactions were dizziness, headache, nausea, and double vision. And that's what I've seen in the patients that I've used it in who have had problems. I haven't experienced a patient who had tinnitus or ringing in the ears as a side effect. I don't know if Laura has, but there are reports of it. After it was marketed, it was estimated that maybe between 1 and 10% of patients who used it as an add-on anti-seizure medication developed tinnitus. If I encountered a patient who reported tinnitus when they were on their medication, I think it would be really important to look for other causes of the tinnitus before I attributed it solely to the lacosamide therapy. So tinnitus is most commonly the result of abnormalities in the auditory system. And sometimes we don't find a cause, but we need to screen for sensory neural hearing loss and make sure that the patient's not on any other medications that could cause tinnitus. Assure that the patient doesn't have an infection or another abnormality of blood vessels or a tumor that could be causing the tinnitus. If I were pretty confident that those things didn't exist and the patient clearly told me, the woman told me that they never had tinnitus before and they had tinnitus when they started lacosamide, I would strongly consider that the tinnitus is attributed to the lacosamide and might think about converting them to another seizure medication or changing them over.
What seizure medications are known to interact or interfere with birth control?
Sure, so I can speak to this question. In the presentation, we discussed some of the medications that are known to interact, and these include oxcarbazepine, known as trileptal, felbamate, known as felbutol, lamotrigine or Lamictal at high doses, topiramate or Topamax at high doses, phenytoin, also known as Dilantin, and phenobarbital. These are medications that can make birth control less effective at preventing pregnancy. There are also medications where birth control can make the anti-seizure medication less effective at preventing seizures. The major one is lamotrigine, also known as Lamictal. So as I mentioned in the presentation, if you're taking lamotrigine and you're thinking about starting a method of birth control, particularly Nexplanon or a hormonal contraceptive pill or patch or ring, it's a really good idea to let your epilepsy doctor know. In addition, there's a minor interaction between methods of birth control and Depakote, also known as valproic acid. But this interaction it's unclear if it has any clinical significance, meaning it's unclear if it actually changes patients' seizure frequencies in a meaningful way.
How does epilepsy affect one's menstrual cycle?
Sure, so I'll touch upon this question as well. In the presentation, I mentioned that women with epilepsy are at increased risk of polycystic ovarian syndrome, or PCOS. And this condition entails problems with the menstrual cycle, including skipped periods, prolonged periods, or heavy or painful periods. That said, the hormonal difficulties that occur in PCOS are somewhat of a spectrum, and women with epilepsy can be affected by hormonal changes without meeting the criteria for PCOS, but still having some of the same problems. So some women with epilepsy do report issues with their periods, but it's very unpredictable who might have those problems and what kind of problems they might be.
Okay, and the final question that was sent in was, what is the relationship between menstrual hormones and epilepsy?
Sure, and I'll address this question as well. In the presentation, I mentioned that estrogen can increase the risk of seizures, and progesterone can actually help prevent seizures. The data that we have for this with estrogen largely comes from studies in animals. In progesterone, there have actually been some studies of giving progesterone to women with epilepsy to see if it treats seizures, and the outcomes are mixed. Some women who have more seizures around the time of ovulation did show some benefit at getting progesterone, around the time of ovulation to help prevent some of those seizures that were happening around that time.
Okay, well, that's all the questions that we've received. That was fantastic information. We learned so much from our expert speakers, and you have provided us with really important education on women's health and living with epilepsy. And I want to acknowledge and thank everyone for their efforts. Dr. Laura Kirkpatrick, Dr. Ann C. Van Cott, and Dr. Amy Collins. We appreciate your willingness to be a part of this event. We hope that you'll be coming back for our next presentation. We're going to be having a speaker series every month through the end of this year. So in closing, I just want to thank everyone who registered for today's webinar, and I wish you all the best, and hope to see you at the next webinar. Thank you, everyone.